Hello, my name is Andrew Conaway, and this video is for Tracy Koch, the instructor for Nursing 442 at LCSC. With a group of, I believe, 15, I was fortunate enough to accompany some amazing nurses to Nicaragua this summer, one of which was your very own Tracy Flynn. This community assessment will focus on the town of Jalapa, which is where our group spent the majority of our time and provided the majority of our public health services. Bordered on the north by Honduras, the south by Costa Rica, the east by the Caribbean Sea, and the west by the Pacific Ocean, Nicaragua is home to approximately 6 million people. The country's capital, Managua, home to 1 million of those Nicaraguans, is bordered by two of the world's largest freshwater lakes and a string of multiple active volcanoes up the Pacific coast. From the 1500s to 1821, Nicaragua was colonized by Spain, giving rise to the deep-rooted Roman Catholicism and widespread use of Spanish as their national language. After Nicaragua claimed independence from Spain, political unrest and financial instability plagued the country. This was only amplified years later by the devastating loss of the bid to Panama to build a canal connecting the Atlantic and Pacific Oceans. And again, poverty and corruption worsened when the Somoza family dictatorship took power for about 50 years, who among other things threw aside education to make way for political issues. The discontentment of the Nicaraguan society became more and more prevalent during this time, until civil war broke out, bringing the Marxist Sandinista guerrillas to power in 1979. At this time, approximately 3/4 of the rural population was illiterate, and rural schools offered only 1 or 2 years of schooling. Some secondary institutions existed, but were private and too expensive for the vast majority of Nicaraguans. A deplorable 22% of children finished 6 years of primary school. The Sandinistas increased the number of primary and secondary schools as well as the number of teachers, which resulted in a dramatic increase in literacy rates among children. Cooperatives were also organized and funded by the government to teach basic reading and mathematics to adults in more rural communities. The Sandinista rule lasted throughout the 1980s until other parties came to power in the 1990s through winning elections. Unfortunately, in 1998, Hurricane Mitch demolished much of what was rebuilt, killing more than 9,000 people and leaving 2 million homeless. In 2006, the former Sandinista president, Daniel Ortega, won the presidential elections and has held office since. Though some improvements have been and continue to be made, poverty remains one of the largest problems in Nicaragua today, with approximately 80% living on less than $2 a day. High unemployment and low education rates unfortunately predominate Nicaraguan society. I was told personally by one of the nursing students in Jalapa that out of their graduating class of 8 students, only one of them is expected to find a job within the year. And with their hard-earned degree, they have to work in their province of Nueva Segovia or the surrounding northern territories, and are not allowed to work in other areas of Nicaragua, including the capital Managua, due to lack of uniformity in educational standards. Nicaragua's history is important to learn in order to understand why the standards are where they are today. Also, to see what happens if education is not given the social importance and governmental backing that it deserves. The province of Nueva Segovia, bordering Honduras, where Jalapa is located, is part of what is known as the highlands. The climate is more temperate and the soil more productive than the southern lowlands. It was interesting to me to see the juxtaposition of tropical palms and banana trees alongside the tall pine trees that I'm used to at home as we traveled further and further up into the mountains. The majority of Nicaraguans living in this area had some connection to a farm, whether through family or otherwise, and more often than not, the farm grew coffee. Another very productive crop was tobacco. We saw hundreds of large buildings out on fields where tobacco leaves are stored and dried slowly over years. Later in our trip, we were fortunate enough to tour one of these plantations and saw the very involved process and the huge number of workers it takes to produce a single cigar. Likewise, as a group, we were shown the process that coffee goes through to become what we recognize it today, what we recognize as coffee, which starts as a red berry not that dissimilar to the look of a cherry, each with 2 coffee beans inside. It takes an extraordinary amount of people to cultivate these beans. These industries, along with others like sugar, rice, and corn, are the sources of livelihood for the majority of people in and around Jalapa, which is upwards of 20,000 people. The town of Jalapa itself is composed of a grid of 30 to 40 blocks of businesses ranging from restaurants to hardware stores, pharmacies to shoe repair shops. We visited the town library, which is where we met and discussed curriculum with nursing students and instructors of the local Universidad de Martin Lutero. We also visited a business on the corner that provides shelter and advocacy to victims of domestic and sexual violence. They have to forge through so much political red tape and lack of support, but the fact that they are present and trying to make a difference is monumental. They said that since they've opened, men have stopped openly hitting their wives in the streets, which speaks for itself on how important these public health issues are and how local people are addressing them to the best of their ability and actually making a difference. Another interesting and empowering group that was formed near Jalapa is a cooperative of women that teach other women how to weave and sew these bizarrely shaped baskets out of dried pine needles. These types of collaborations are not unique, and many cooperatives exist that invest in the local people and resources as a source of development of the region and its inhabitants. This is a source of community strength, and one I did not expect in such a small rural town. It may be stating it a little roughly, but the houses in and around Jalapa where families live would probably be considered condemnable if standing in the United States. They are often cement or made out of this very interesting clay brick that is dug right out of the mountainside. The roofs are often made of ribbed sheet metal, sometimes topped with red clay tiling. I didn't see many actual windows, and instead I saw a lot of wooden slats. The homes, even in the middle of the day inside, are very, very dark. But Nicaraguan people are warm and welcoming and always have an open door policy. My first impression of Nicaraguan people were how uninviting their expressions seemed, but I soon realized this was just the face of wary curiosity, and the moment you speak or show interest or need help, they are very accommodating and friendly. 3 of us visited the house of a young mother raising a little girl with hydrocephalus, as you can see on my slide. Like I mentioned before, the house was dark. The furniture, what there was of it, was in disrepair. The floors were uncovered cement, but still it was tidy and organized and surprisingly homey. Throughout my time in Nicaragua, I realized that the Nicaraguan people have a natural sense of aesthetics and work with what little they have to make their houses look pleasant, inside and out. Almost every house has deliberately planted vegetation that is pleasing to look at, whether it is the color or shape or its flower planted outside of the house. Many times, more times than I can count, I saw the dirt being swept, both outside and inside the houses, to keep it tidy. Another very interesting aspect I noticed, which has been integrated into their way of life, is the use of living fences. Almost every piece of land, big or small, had a fence around it, which had often barbed wire stretched between a couple posts and then a living tree, then a couple more posts, and then another tree, and so on. And the trees were often producing trees. Nicaraguans have a lot of protective factors built into their way of life. With the resources and education and bit of help groups like ours are able to offer, families can thrive. One of the initiatives some of us were working on with some families was installing new cook stoves that had chimneys that went outside rather than cooking without a chimney and inhaling smoke daily. This intervention will prevent a plethora of possible lung and respiratory problems, as well as the development of asthma, which is all too prevalent. The majority of my work in Nicaragua was spent in the classroom, teaching with a small group of my peers about dental health, respiratory health, basic hygiene, and hand washing, and the World Health Organization's oral rehydration solution for treating dehydration caused by acute diarrhea or vomiting in children. This was a lot of fun and reminded me of my past teaching in Thailand. However, Nicaraguan children are much more behaved than Thai children. With the help of our incredibly talented translators, we had the children answering questions, repeating information, and demonstrating what they had learned. The classrooms I visited ranged from basic cement windowless rooms to full classrooms outfitted with black and white boards. The majority of classrooms, particularly in the rural areas, had multiple grade levels per room. The kids wore uniforms and whatever their families could afford. Education is essential to public health and development in Nicaragua. What I saw of the education system was sufficient to cultivate better prepared generations to provide a positive change in Nicaragua. But there is a lot of need in the education system too. The greatest of which is to keep these young people in school through to the end. The translators told me that about half of their high school class each year never graduates. That is a 50% dropout rate. Children in many families are the source of labor and income and are needed at home for the family to survive. But that dropout rate is unprecedentedly high, and without those kids in school, their community will only be able to survive and not able to thrive. In addition to several of the schools in the area, I was able to visit the local hospital. Unfortunately, this facility mirrored the same building characteristics I mentioned before, such as very poor lighting. Off a long, dark central hallway where were large rooms, each one a ward. There was the men's ward, women's, pediatric, maternity, and isolation. The rooms had each room had multiple beds with patients resting on them, often with wound dressings or IV lines set at a drip rate, no IV pumps. At the end of the hallway was the birthing and surgery suites. Our group brought 22 very large duffel bags, mostly full of clinical medical supplies, which I saw the need for firsthand as I looked around this hospital. Unfortunately, 7 of those bags were taken by customs, but 15 bags still made it to those doctors and nurses, the nursing school, and ultimately the community in and around Jalapa. I still have an entire storage unit full of donated expired surgical equipment I am hoping to further donate to future trips. The healthcare infrastructure is in need in Jalapa. During my time going from door to door doing health screenings, we confirmed what we already knew, that preventative care is needed. the need for people to address concerns before they become medical issues is great, and great everywhere, worldwide. All together, we tested and provided at least 50 reading glasses to the older population. We found a handful of people with concerning blood pressures and pulse irregularities, and another handful with signs of asthma. Also, another handful we realized were living with unaddressed chronic pain. Overall, I would say the healthcare system in Jalapa is surviving, but unable to thrive, which is defined by growth and development in this environment where need exceeds the available resources. Overall, there were a lot of strengths in the Nicaraguan community in Jalapa, some innate and others achieved through hard work. And on the flip side, there were a lot of varied needs too. Education and healthcare are two great areas where notable advances have been achieved, but a lot more is needed. And that is exactly what our group was there to address, and groups like ours. I'd say our group made a small dent in the huge barriers that Nicaraguans face during our time there. And personally, my time providing public health nursing in Jalapa was challenging and rewarding, unbelievably informative, and extremely fun. I invite you to supplement this presentation with my journal entries to get the more in-depth information into my time in Jalapa, my teaching experiences in the classroom and the door-to-door screening. It goes more in depth into the day-to-day activities. And otherwise, I thank you for listening.